All right, here we go. Last time we went over the ribs and their articulations with the thoracic vertebrae, how they kind of align or articulate with the different facets. And so now moving down, we have the lumbar vertebrae. So we will start, as always, with an orientation. Roz, what is that blue line I just drew? It is a plane, yes. We call this the midline. Let me make sure I got my slides up here to cheat off of. Chloe, what are these red arrows indicating? So if this midline is medial, what are those red arrows pointing to? Lateral, thank you. Kayla, you want to tell me in this direction where I'm drawing this black arrow. So where is anterior on this image? Top. Anterior and posterior. All right, we've oriented ourselves. Now let's start highlighting some structures here. Let me get something. This is lumbar spine, yes. So this is lumbar. So this is going to be L1 through 5. Mia, this portion that I'm highlighting red, what is that portion? Body. Bree, can you tell me what these two portions are that I just highlighted? Yep. Nope, it's not a facet. Try again. It's close to the transverse process, but not quite. It's not the transverse process. Teo, you want to help Bree out? What is that structure? Yep, the pedicle. Bree, can you tell me what this structure is that I'm highlighting? There we go, spinous process. Andrew, can you tell me what this process is? Yes, the transverse process. All right. And then Grant, can you tell me what this part of the vertebrae is? That pink highlighted portion. The lamina. Thank you. And since we're looking at a superior view, Parker, can you tell me, I already have red on there. Do orange. What these processes are. Those features. Can you see what I'm pointing at? Here, let me circle them for you. Black. These ones right here. What are those? There you go. Superior articular facets. All right. Tim, what is one feature about this lumbar vertebrae that you see is different than the rest of the vertebrae? Ish. I don't think that's a necessarily unique feature. Those I wouldn't call them sticking out. I think that's just a feature of the image. Yeah, I'm gonna say that's just a feature of the image. Yeah, how is the body different? A lot round. It's a lot bigger. So in lumbar vertebrae, we can see this body right here is a lot beefier than the other vertebrae. Isabel, why might the lumbar vertebrae need to be more beefy? Absorbing more weight, yeah. So when we think about the lumbar spine, it has to hold up the rest of the spine, right? And as you get farther down, each sequential vertebrae that is more distal or more caudal has to support more weight than the previous vertebrae. So they have to get a lot bigger, a lot stronger. All right, good. Any questions on the superior view? All right, now we're looking at a lateral view. Michaela, tell me what I'm drawing here with this black line. What directions are we talking about with that? Good, anterior and posterior. Which side is anterior? Which side is posterior? Good. And how do you, Kimmy, how do you orient yourself for anterior and posterior with a vertebrae? Where the spinous process is? Okay. What direction is the spinous process pointing? Posterior. Good. That's a good way to do it. Roz. This structure is? Yep. And Chloe, what is this structure down here? What might that structure be? It's an articular process, yes. So which one is it going to be? So I have inferior articular. What's that last word I'm looking for? Process. Kayla, the portion that on this inferior articular process that articulates, so if I have this red line right here, that piece of cartilage, what is that structure going to be? It does not articulate to the rib. So unlike the thoracic vertebrae, the lumbar vertebrae do not have articulations with the ribs. So on the inferior articular process, what is a feature on that process? Yep, the facet joint. That's the inferior articular facet. Good. Mia, I forgot to draw this line. What might that line be trying to represent? Say again. Medial. No, so we're looking at a lateral view, so we can't necessarily, I mean, it would be poking out of the screen here, so look like that. Medial and lateral line look like that dot that I just drew. So I'm not talking about medial and lateral. Cranial and caudal, what are other terms that we can use for cranial and caudal? Yes, thank you. Superior and inferior. All right. Let's see. Bree. What is this process up here? The lamina? No, I wouldn't say that that's the lamina. No, not the transverse process. Look where it is in relation to the rest of the spinous, in relation to the rest of the vertebrae. There you go, superior articular process. Teo, if this vertebrae is the, let's say this is L2, second lumbar vertebrae, what vertebrae is going to be right here? L1. And so that superior articular process is going to articulate with what on L1? Yes, the inferior articular facet. So those facets, right? They, the facet joints articulate. A superior one articulates with an inferior one from the one below. So as Teo pointed out, L1 would be right here. The inferior articular process would articulate with the, inferior articular facet would articulate with the superior articular facet on L2. And let's erase this here. Let's label this. Let's say this is L2. That's not nearly thick enough to see. L2. Let's say that the one above it is going to be L1. So the inferior articular process from L1 will articulate with the superior articular process / facet joint of L2, and so on and so forth as we move up and down the spine. All right. So then, Andrew, can you tell me what is this structure going to be right here? The pedicle. Yes, very good. Pedicle. All right. Last structure I'm going to label on here. Grant, what is this structure? So remember, lumbar vertebrae don't have articulations with the ribs, so it doesn't have a costal facet. That's just thoracic vertebrae. So what other structure might that be? Yes, the transverse process. All right. And then I'm going to steal this very easy one. This is the body. I hope that you all can identify the body of vertebrae by now. All right. Any questions on lumbar vertebrae? All right. We're moving on. So you can see here in this one, as I mentioned previously, those lumbar vertebrae having a large, thick body, and they have short, rounded spinous processes, just as a feature of being more load-bearing, and they have some muscular attachments that need kind of stronger attachment points. And then we get into the sacrum and coccyx. The sacrum is a bit of a special section of our spine. It's the what I'll call final segment, most caudal segment of our spine, and it consists of 5 fused vertebrae. And those vertebrae, when you look at one of our skeletons over here, you can see that sacrum helps to form a ring, or as we'll get into later in the lower extremity, a brim. And it is kind of where the strongest attachment for our spine to our pelvis is, where you can see here, so this on this articular surface right here on both sides of the sacrum, where it's going to articulate with the pelvis. And so you can also see the vertebrae in here of one of these sacral bodies. And then we also have the sacral crest, and then the coccyx is down here, the small triangular one. And so this is kind of what people think of as their tailbone. And then kind of finally, we also have these holes or foramina. Right next to all of the individual vertebra or individual sacral vertebra. The sacrum coming out of these foramina are a lot of nerves, and so you might hear of people having sacroiliac issues or SI joint dysfunction or issues. A lot of times that can be a misnomer because it's more so muscular rather than actual bony injury. So right now, all I need you to know is which one's the sacrum, which one's the coccyx. Know that it has foramina, and that it's part of your pelvis. It helps form part of your pelvis. It's the most distal, most caudal portion of your spine. Okay. Any questions on the sacrum? All right. Chugging along. So one problem that can happen in our spine is a herniated disc. The discs, as we went over previously, it's made up of those two portions. We have that annulus fibrosus and the nucleus pulposus. So the nucleus is that soft gel in the center. The annulus fibrosus is that more fibrous outer ring. And so what can happen is discs can protrude out from where they normally should be. Typically, they protrude posteriorly. So they will start to put pressure on the spinal cord, and typically it'll start protruding into or onto one of the nerve roots rather than the spinal cord itself, because there's a much thicker tendon, or excuse me, not tendon, ligament right here, right behind the disc, and so it'll protrude out. You'll have patients with one-sided symptoms, and if it gets bad enough, patients can have their discs removed. They can have vertebrae fused, and it can be quite painful for patients. Isabel, what causes this? It can be caused by bad movement patterns. It can be caused by a singular event. It can be caused by trauma. It can be caused by old age. It's what will happen is the reason kind of all injury. I'm gonna take you way back. The reason why all injury occurs is there is a typically there will be a atypical stress placed upon the body that it is not used to, and so then that stress will cause that normal tissue to change or deform in some way, right? So fractures, for example, right? You're placing an abnormal amount of stress on the bone, and so it can't handle that stress, so it deforms. And you can also have the inverse happen where you have normal stresses placed upon tissue, placed upon abnormal tissue. So if tissue, say, is in a weakened state or has something wrong with it because of an underlying condition, that normal stress can also cause injury. But that, you can have either abnormal stress placed on normal tissue or normal stress placed on abnormal tissue, and that can cause injury. All right. And then what we also have, like I talked, we have ligaments on the vertebrae. We have a ligament in the front, so it's called the anterior longitudinal ligament. We also have the posterior longitudinal ligament, which is in that vertebral foramen. We have the supraspinous ligament, so that kind of connects all the spinous processes. We have the nuchal ligament, which kind of connects more of our head to our spine, and kind of connecting from that apex of the external occipital protuberance all the way onto our cervical vertebrae. So those are the three kind of big ligaments. They quite strong, and they help stabilize spine, but they don't completely wrap around the spine, and don't completely kind of wrap around where the intervertebral discs are. Otherwise, we would have a lot less people who have discs that protrude laterally. Okay. All right. Now we are getting into ribs. How much more time do I got? All right. I got 5 minutes here. Give me 5 minutes and we'll be done. All right. So we have a number of ribs. We can label these ribs 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And we have peeking back there, 11 and 12. Okay. So the thing about ribs is that we can classify them differently. Numbers, so ribs 1 through 7, these are true ribs. And so the reason that they are true ribs is that you can see that they have a direct attachment onto the sternum through their cartilage, right? 1 through 7. But then we also have 8, 9, and 10. We call these, so here, we got these ones. These are true ribs. We also have 8, 9, and 10. These ones are false ribs. It's not that, they're not actually there. It's that they just have a common cartilage attachment through 7 onto the sternum. And so they're, since they're just more cartilaginous, they're false ribs. They have that cartilaginous attachment through the cartilage of rib 7, but they still have all those bony attachments onto the vertebrae. And then last we have 11 and 12. You can see those kind of peeking out back there, 11 and 12. And we call those ones floating ribs. We call them floating ribs because they are literally kind of just floating around. They have that bony attachment onto the 11th and 12th thoracic vertebrae, but you know, they don't have that cartilaginous attachment onto the sternum, unlike the true ribs and false ribs. So other features we can see. So we can see that costal angle back here, right? That costal angle. We can see the body. The body of the rib as it goes down. We can see all of this cartilage in here has a specific name, and this is costal cartilage. Costal cartilage. Okay. And then we also have the sternum that is made up of a couple of different parts. We will get to that later. And then we have two last things here. We have, so these, so if you think about aperture and like photography, how small or big you can let light in through. So there, we actually have, you know, one of our microscopes. You can modulate how much light you let through the bottom. So those are apertures, and on the ribs we also have apertures. So we have the superior. Let's change this to red here. So this one up here. Let's do just a bit thicker line. This one up here is going to be the superior. No, let's. Superior thoracic aperture. And then the aperture down here is going to be the inferior thoracic aperture. All right. All right, so we got our ribs, they're numbered: true ribs, false ribs, floating ribs. They each articulate with at least 2 thoracic vertebrae. And the true ribs all have a cartilaginous insertion into the sternum. So the entire structure that is right here that I'm highlighting in yellow is the sternum. All have cartilaginous insertions into the sternum. The false ribs have cartilaginous insertions into other cartilage on the ribs. And then the floating ribs just have that attachment on the thoracic vertebrae, and they are floating ribs. And we have our two thoracic apertures, superior and inferior. And that's what I have for you all today on the ribs. Okay. Kayla asked me earlier when we might have our exam. So if looks like we're going to finish the axial skeleton next class. So then we get 1, 2, 3. We're going to do it after fall break just for logistics. So here's what 1, 2, 3, 4. So here's what we'll do. We will do, we will have next class, we will do the last couple of slides. I will give you all 3 class periods, and then we will do one, the class before break. We will do review, and then not the first class you come back, but the second class after fall break. You will have your exam so that I have time to set it up. All right, so that should give you plenty of time. Any questions on the stuff that we went over today, went over previously? All right, go have yourself review stuff that we have already done.